Hi, I'm Stacey Parker and I work for Peri Referrals, a veterinary dental specialist. Today we're going to cover loads of information for the nurses, including different dental presentations, managing their anaesthesia, including airway security, hypotension, hypothermia. We're also going to cover good dental analgesia and post-operative care. And also we're going to have some course and case studies that we can go through together as to how we would manage each case. I often find dentistry anaesthesia a little bit of a roller coaster. 1 minute they're having a really nice time, the next minute they're not, and it's all up and down. So hopefully if we learn more about how we can maintain the anaesthesia and the analgesia through the next few lessons today, then it will be less of a roller coaster ride for everyone. Hopefully you're all a bit warmer as well now. I'm still pretty cold. So objectives that we're going to cover today is what is pain and why should we avoid it? It sounds like a simple question, but it has some really decent answers that I think we all need to think about together. Different drug choices that we have and their different side effects, the doses that we can use and the routes of administration. We'll also cover local nerve blocks a little bit. I've got a few videos and a little bit of the more written stuff that what Rachel went through earlier, but hopefully from seeing it earlier, it will tie in nicely with what I've added into here. I don't currently place them myself, which is why I wasn't helping you earlier, because we are so busy that there is no time for me to step out and go and learn these things at the moment. And we don't have a second nurse to take over the anaesthetic while I learn that kind of thing. But it is something that we're keen for me to do, and I think it's something that nurses are ideally placed to be doing. If you can get trained, I think that's great. And we're also going to cover some post-op analgesia as well. So pain is an unpleasant sensory and emotional experience, so we definitely want to be avoiding that. I know I'm no good if I'm in any pain. I'm an absolute wuss, and it's a really negative, stressful experience for me. Even when someone can verbally explain what's happening, I just can't settle if I'm in any form of pain or discomfort. So we need to try and avoid that for our patients where possible. A lot of our dentistry patients are also going to be in chronic pain, so they've already been in pain for quite some time before the dental surgery is suggested, or maybe the owner's accepting that it needs to happen and therefore we actually get it booked. And there's many things that can cause pain in dentistry. Loose teeth, resorptive lesions, fractures, tumours, actually just scaling the teeth. I had that done on my own teeth once, and as I've said, I'm a wuss. But it was really painful, it's really tender, so I think even when you think, inflamed gingiva when we're cleaning it is really uncomfortable. Abscesses, that pocket of inflammation in that short area is really uncomfortable. Exposed roots through periodontal disease or trauma is also really uncomfortable, and root planing and the actual extractions that we're performing are also, or the vet is performing, very uncomfortable. So pain can delay healing, it's emotionally distressing, they can cause self-trauma, and they causes the inability to eat, which obviously is not compatible with life. So we need to make sure they're comfortable enough to get those nutrients to stay healthy and well. And being in pain does lower your quality of life as well. There's many, many signs of dental pain, and that will vary between breeds, but we'll focus on dogs and cats. You are probably aware of most of these, but favouring one side, salivation, halitosis. They might go to eat but refuse, eating very fast but with no chewing, and then they vomit shortly after. And that's quite indicative in cats of painful teeth, is that they would just inhale their food and throw it all to the back, because if they eat it quickly and don't chew it, then it doesn't hurt. But then their stomach's like, no, and up it all comes again, completely undigested. And I didn't realise that was a sign until my cat kept doing it, and then I finally gave in and gave him a dental because I was terrified of his anaesthetic, but we did it, and he stopped doing it, so it is a real sign. Reduced movement, pouring at the face, a change in character. Sometimes the owner doesn't notice a difference because it's come on quite gradually, or sometimes there just isn't any signs. And it's only afterwards that the owner says, oh my God, they're like a new cat or a new dog. They're so much happier since they've had the dental work. Particularly with cats, as we've ascertained, they just hide everything. Do any of you use pain scoring in clinics? Good, so that's really good, because I think if I'd asked that question sort of 5 years ago, I don't know if you'd agree that we probably wouldn't all be nodding. We'd be like, I've read about them, did them for my veterinary exams, but I don't actually use them. We use them all the time, and I think the pictorials are really good. I don't know about you, but they're really good because you can doesn't mean that, I think it's easier for us to be quite a baseline with it, and is not so much for personal intrusion of it. So you don't think, oh, I think he looks painful because of this. You're all working from a fact sheet and giving it a number, and we can compare that number despite who may have pain scored that animal. So I do believe in them, even though when I first started learning about them, I was like, oh God, another checklist, another thing to do. But actually, when you get used to them, I think they're really good.